Hi, I'm Dr. Lisa Gilbert here again to share some pearls of wisdom. Today, I want to talk about suicidality, but an alternative trauma informed perspective. But I'm going to begin by just saying if you're having serious suicidal thoughts, please dial 988 and get assistance. To start a talk like this and have to begin with a very impersonal, call 988 for help actually kind of bothers me. It bothers me because the best practices policy inadvertently has stumbled into a dilemma, and I'm going to explain this dilemma. First, I'm going to say that not all suicidality is the same, and I am specifically talking about the kind of suicidality that develops when a person has a trauma history or is blended with PTSD. And that, of course, brings to play the trauma traps that I described in an earlier Pearls of Wisdom discussion. When a person is feeling disempowered and trapped by life circumstances and stressors, it can ignite PTSD, as I explained earlier. When that happens, the internal emotional system naturally wants to find a way out. I mean, we do want to heal, just like our cuts heal, we heal. And you develop your list of choices unconsciously. However, it's often not very good. That list of choices might only have one thing on the list, and that one thing might be whether I take my next breath or not. It's a very powerful uh, decision to say I'm going to live or I'm not going to live. It's sort of the ultimate power or the ultimate trump card, suicide king card. What if that's the only card you have in your hand? This is your only choice. That's rough, but I'll tell you that death is preferable to soul annihilation. And when you are faced with the kind of traps that overwhelm your personhood, it feels like your soul is being annihilated, and I would rather die than let that happen. So, having this trump card in my hand empowers me. It gives me agency. It keeps me in the game. The policies, best practices, want to have us take that card away. They want us to make the suicidal stuff go away. Well, that's a problem. If that's the only card the person is holding that's keeping, this annihilation scenario at bay, you might just inadvertently take this away and throw them into the trap, throw them into the lion's den, and suddenly they are flaming with anger and impulsivity because the escalation of PTSD shoots way up and they then act on the suicidal thoughts. So maybe you don't want to take the card away. I think there's a better solution here because suicidality is not the fundamental problem, it's the resultant. It's a result of the fundamental, and the fundamental is the trauma, which causes depression, anxiety, all sorts of flavors of PTSD. Don't take the card away. Understand the card and the dynamic that the person is grasping for agency to stay in the game. It's better to help them develop a whole slew, hands, multiple decks of cards than to just have this one. That's the solution, not taking this away, especially when someone has trauma and they're chronically, intermittently having suicidal thoughts. Understand why. Because every time the suicidal stuff pops up, maybe look at what's causing them to feel trapped this time and address that. Help them develop a hand of cards that keeps them in the game without having to play this one. In fact, once they have their hand fully established and they get comfortable with it and they're used to it, pretty soon this goes to the bottom of the deck and then maybe they discard it. They don't need it anymore. It goes away. So, suicidality isn't the enemy. It isn't the thing that needs to be extinguished. The traps need to be extinguished, they need to be deconstructed. And also understand that when a person is, the PTSD is ignited, they catastrophize, which just means they make everything big and worse. So the trap is even larger and bigger than it really is because of their, remember, their giant radar. They're perceiving this trap as being enormous, unfathomable. They can't deal with it. So up comes, can't pick it up now. Up comes the suicide card, and then of course the system kicks in, all therapy stops. The relationship between the client and the therapist seems to alter. The evaluation form feels like it's an AI sounding litany of questions that you have to go through. It takes the personal connection away, which even further disenfranchises the suicidal patient. The client that comes in that's already feeling trapped and has only one choice, which is that they can live and die. And then you turn into a different kind of being as the clinician, where you're doing the AI list of all the elements of their suicidal thinking and ignoring the big picture of the trap and the PTSD and the trauma. It's a bad equation. Get the hand, leave this in the hand, get it to the bottom, and eventually discard it. It sounds simple, I know. It's a lot of work to develop the hand, but I guarantee you it can be done. You can keep playing the game. Little by little, find your other cards. Those cards are therapy groups, they're self care, sometimes it's medication. There's just so many other elements that go into this hand. And understand that it is important that you keep your agency and your power, and that people and systems don't take it away. But you don't have to die. You don't have to actually suicide to make this work. So I will leave with, if you feel more suicidal after listening to this, please call 988. But hopefully you feel more empowered and have more ideas about how to self-manage, as well as connect with a clinician around, what does it mean when I'm having suicidal thoughts? Does it really mean I'm feeling super trapped and I have no choices? And can you help me get some choices? I hope that this gives you an alternative view, a trauma-informed perspective on suicidality, and wish you well, and thank you for listening.